Hi, good afternoon, everybody. I'm Jody Hanson. I'm the Director of Public Affairs and Communication for Johnson County Government. With me today is Dr. Sami Ariola, who is the Director of Johnson County Department of Health and Environment. We also have Elizabeth Holshoe, who is the Director of Epidemiology. And we have Kim as our ASL interpreter. Thank you all for being here today. Dr. Ariola, I believe today was our first clinic for 65 plus at our own vaccination site. Maybe you could tell us how that went today.
Yes, thank you, Jody. Good afternoon, everyone. Today was our first clinic that's targeted towards 65 plus. We have been vaccinating in the 65 plus category, even though we focused on the subset of that, which is 80 plus. But throughout this process, we have been vaccinating persons that are 65 plus. So have our partners, our health systems, and local pharmacists vaccinating. But today, we started a series of clinics that are exclusively focused on 65 plus. Went pretty well. We typically debrief after the clinics, and we did slightly over 1,200 vaccinations today. We have appointments that are available for next week, Tuesday, Wednesday, Thursday, Friday, all for 65 plus. We just had a meeting with our health systems, and they are continuing to vaccinate in that group. Candidly, there's not a better time to get an appointment to get vaccinated in that group. And we have been, Elizabeth and our team have been looking at data along with DTI, trying our best using data that's not really geared for this purpose, but doing the best that they can to guide our efforts to see where we are, how many people remain, how many people would remain after next week. And those are the things that guide our decisions. Do we need to open up additional clinics after next week for 65 plus? And so it's very important for you to check your email or the point of the way that you have access to contact you, book an appointment, get vaccinated. If you are yet to complete the online vaccine interest form, go ahead and do it. If you need help doing that, call us again, 913-715-2819. We have staff there that will be there to assist you. And the appointments are not just with us. Our health systems have appointments also. Again, we just talk with them, and they're all ready to go. The good news, Jody, is as we are tracking our numbers, we understand that there are additional groups that are in phase 2. As always, Elizabeth will provide updates as to where we are with our educators and childcare establishments in terms of vaccination. Again, she's got some really good news about the next few weeks and how we expect to be finished with those in the coming weeks. But we were very lucky this week also to get a third vaccine approved into the market, the Johnson & Johnson, and also lucky as a county to get a few doses of those. And we have 3 vaccines that are out there that are very effective and that are very safe. All of them are 100% effective in preventing death, 100% effective in preventing hospitalizations. All of them are very safe. All of them with a very high degree of preventing severe critical illnesses. And so, and that's our goal. That's what we think. We'd always thought that this allows us to get more vaccine into the county, which allows us to get more vaccines into your arms as quickly as we can. That's what we're trying to do. So we're beginning to work with groups that are part of phase 2. We're beginning to work with stakeholders that in congregate settings to vaccinate our homeless population. We're beginning to talk with groups to vaccinate our grocery store workers and other groups that are part of group 2. Again, all those, how quickly we move through those depend on availability of vaccine. But in the next couple of weeks, if the way that we're looking at this, if we continue to get interest and open up appointments for the 65 plus, with the increase or the expected increase supplies that should come into our county, we feel a lot better in terms of where we'll be in the next few weeks than we were a few weeks ago. I do want Elizabeth to spend some time to talk about vaccination K through 12 and childcare facilities, and then I'll come back and address a few other issues.
Haven't done that in a while, so now unmuted. Thank you, Dr. Ariola. I would like to just re-emphasize a point that he made. You know, we hear a lot in the media about the efficacy of these various vaccines, and I think that people take that to mean that they are not, that there may be one or two that are better than the other ones, and we want to try and dispel that. Really, as he was saying, all three of these vaccines are pretty much 100% effective against hospitalization and death. Now, some of them you may have a likelihood of having some symptoms of COVID-19, but the important thing is that it's gonna prevent those really severe outcomes. The other thing I'd like to point out, you know, a lot of people are saying, you know, I really want this one vaccine or this other brand, but you know, when we do flu vaccines, nobody really knows what the manufacturer is that you receive that vaccine, right? I don't know what flu vaccine manufacturer I received this year. So I would just like to advocate that as we're getting these different vaccines into our county, if you have the opportunity to get that vaccine, no matter what manufacturer it is, go ahead and do that. They are all highly effective against really severe disease. And that's really what we're aiming to do here. You may, if you get exposed, maybe you do have a few symptoms, but it's not at all going to be like it would be if you were unvaccinated. So please, if you have that opportunity, no matter that manufacturer, go ahead and get that shot. As for K through 12 and childcare, we are very busy, and by we, I really mean Children's Mercy and some of our staff, in vaccinating, trying to get through the rest of our childcare providers and our K through 12, public and private and parochial staff. This week is very busy. We had a clinic last night for childcare licensing. We have a clinic tonight and tomorrow night for K through 12, and these are being held at one of the Blue Valley facilities. So we're appreciative to them for their partnership and allowing us to use their space. This Saturday, we're going to have second dose clinics for childcare and some parochial staff, as well as having some first dose clinics for our K through 12. And we have this set up basically the same exact pattern next week. And so we were trying to figure out our counts for our childcare and our K through 12. And it looks like we're really starting to come down to maybe only needing just those vaccine clinics next week, or maybe one more. I think I heard that we are looking at less than 1,000 childcare staff, and that's for home providers, childcare centers, as well as our school age programs who are left to be vaccinated. So one of our trays has 1,170 doses in that. So the great thing is that we will be able to really stop allocating out some of these doses that are coming into our county for this need, for this group, and being able to refocus them to our other priority groups, the 65 and up. And so we're continuing to work with Children's Mercy, again, just a really incredible partner. I was out at the clinic last night for a couple hours, and really just to see the number of vaccinators they've been able to recruit from their staff to come out and do this. It's so incredibly impressive, and we're so grateful for their partnership. So as much as I love seeing them on a daily, sometimes basis for our vaccine clinics, I'm very much looking forward to us getting through these first doses, and then really through the end of March and maybe the first week of April at the most, getting through those second doses, and then we'll send them on their way to go help out other communities in our area.
So at this point, would it be fair to say that if you work in childcare, that if you work in an education setting, you've been given the option at this point? There's probably not a whole lot of people that have not yet.
Nearly. So I think this week will be that sort of final group that we hope to provide them that opportunity to get vaccinated. So if you're part of those groups and you haven't quite heard yet, don't worry. Really by the end of this week, if you still haven't heard, or early next week, definitely reach out. But I know that through all of our partners, we've continually been hearing about, you know, some childcare facilities that just weren't receiving our emails. And so hopefully everybody's gotten the message. But yeah, really through the end of this week, we hope to get out those final invites for appointments.
That's great news. I wonder if either of you could talk about the number of doses maybe that we've received this week. Have we received next week's doses yet? Do we have kind of an idea of how many doses we're going to be giving next week?
No, we have not received next week doses yet. We have received the doses for this week.
Okay.
And we've talked about receiving 1,000 doses of Moderna, which is we're using largely for second dose. That's the second dose clinic on Friday. We received 3,700 doses of Johnson and Johnson, which again, we are finalizing logistics on that. So a lot of the considerations that we're having is because the biggest advantage to the Johnson and Johnson, outside of the fact that it's a very effective and safe vaccine, is that it is one dose. So in some of the population that we need to address, it is our friend. It just makes our logistics easier when we don't have to do things twice. There are people that we need to go vaccinate at home. There are the homeless population that it's tough to get them together twice. And so those are the things that we're considering as we make our final decisions. But we would clearly uh, um, make sure that we keep everyone informed as we do that. We do have the developmental services, people that are home, that we have workers that are sometimes bringing some of these viruses in. And so those are consideration again continues to be equity, continues to make it to try to make it easier for a vulnerable population to get the vaccine and to get it as soon as they can. And so that's what's going to inform our decisions. We have been in conversations with several groups in the community. We had a meeting with our IDD developmental services community this morning. We have been talking with UCS, Julie Brewer and her team since yesterday. We're in touch with our minority population. We're in touch with churches that they have relationships with. We are talking with advocates for our homeless population in the county. And again, we're wanting to make sure that we reach every group as soon as we possibly can. One point to keep in mind as we do this is, as is obvious, Elizabeth talked about that yesterday in terms of a survey that went out yesterday for a follow-up survey for healthcare. So there are people that are missed in phases. There are people that changed or are going to change their minds after a while. So we can't really say that we finished a group. We continue to look for opportunities to work them in. So that's and she's going to talk about that. That's not just for healthcare workers. And if you talk to all of our health system and us, we continue to work healthcare workers into our clinics. But that's also true for our long-term care facilities. By the way, one of the biggest news, we were just talking about that, Elizabeth. Do you want to give those numbers again? Number of long-term care facilities with outbreaks in December or late November, and the numbers now. That's just some terrific information that we can talk about. Go ahead.
It really is. It feels like not often does the health department get to bring good news, particularly around COVID, but this is really, this is why we do the work, right? So we know that our long-term care facilities have been tremendously impacted by COVID-19. We started working with them very early on to make sure that we were able to protect them as much as possible and, identify cases early on and try and limit the number of outbreaks and the number of people affected by outbreaks in these facilities. But the reality was that once the virus got into the facilities, it was very hard to control, particularly in some areas, if we think about memory care, other things like that, where they are unable to be compliant with wearing a mask or keeping distance. And so we have lost just a huge number of individuals from these long-term care facilities. We've had a lot of sickness in these. And so when the vaccine started rolling out, this was one of the priority areas from the federal government. If you recall, which feels like a lifetime ago, there was vaccine going straight to some of our pharmacy partners, and they were going into our long-term care facilities to immunize both staff and residents. So, at the end of last year, I think we maxed out at 49 different long-term care facilities that had active outbreaks going on. And for that means that there's been a case in the last 28 days. But today we are down to one long-term care facility active outbreak. And quite frankly, they're about 5 days from being off of our list as well. And so really, when we talk about the effectiveness of this vaccine and the safety of this vaccine, our long-term care facilities are a great shining example where, you combine that with our decrease in community transmission, and we've really been able to finally truly create a bubble for these individuals. And it means the world for both them, because it means that we can start talking about having them see loved ones again. These seniors have been so isolated for the last year that this is really a tremendous step for them, for their families, for our community. So we're just thrilled to see really the effects of this vaccination campaign.
So the number of facilities with outbreaks went from a high of 49 now down to one that's about to get off the list. That's huge. And the other thing that she mentioned there is because of vaccination, several of these facilities are now beginning to allow residents to see their loved ones. And that's huge. It's the same reason, because of vaccination, that we are able to support our schools reopening in person. Now, there are risks associated with that. We need to continue to make ventilation, outdoor activities our friend. We need to continue to wear masks. But that just tells you how we, because of the vaccination and other efforts, and I want to add, because of the commitment of our residents to wearing masks, and because of the public health order, we're able to change the trajectory of the virus. I looked at the numbers today. Our positivity rate is below 4%. Our incidence rate is dropping. Those are good things. But like we've said, it doesn't take much to change that trajectory in the other direction. That's why it's important, even as conversations continue across the country. That's why it's important. That's why the CDC, Centers for Disease Control and Prevention Director, came out very strongly today that we don't want to undo the gains that we have made through the hard work of our residents by making decisions at the right decisions at the wrong time. So we have to be very, very careful how we do that. And when people ask me, what's the end game? When do you start unwinding? I'm saying we are vaccinating. Our schools are back in person. We have our long-term care facilities that are beginning to allow visitors in. So yes, we are. There's some things that we need to continue to do to get more of our population vaccinated. We're getting to a place, and may not be that obvious to people here, but we know, where we're going to have to focus our efforts on educating people that are hesitant to take the vaccine. So we're going to have to call people to explain things to them. We have examples across the country where medical doctors are calling people, explaining to them and trying to address their fears, and it's encouraging them to take the vaccine. So we're getting very close to that, and we're hoping that our messages to you about the safety and effectiveness of the vaccine would help address your hesitation. And that's why we're continuing to work with our stakeholders in the county. We need as many of our residents to take the vaccine as possible. We already seen some of the benefits. We're reaping the fruits, but to be able to do that at the level that we want and to be able to sustain that, we just need to keep doing what we're doing.
That's great information. Thank you. And that's a good point to remember, months from now, when our messaging might be changing to trying to convince people why they need to take the vaccine. We haven't had to do that yet because there's been such a demand. So it'll be interesting to look back at these weeks and months and just see how that messaging and the conversations have changed. I'm going to go ahead and take some Facebook questions while we have a little bit of time left. But thank you so much for sharing all that information. Some great news, I think, to just show we're going in the right direction. One question we have, it looks like Joco received around 1,000 less doses of vaccine than Sedgwick County, even though we have a larger population. And they said this is 2 weeks in a row. So do we have anything to say about how the state is allocating vaccine doses to counties?
I don't know how many vaccines Sedgwick received, so I can't speak to that. We have been in a conversation with the state several times. What we'd like to see is for our share of the vaccine to reflect our numbers. We represent just under 21% of the population, and the allocation of vaccines we think ought to reflect that. It currently is not. And so that will be our comment regarding that. But we have also been clear, not just because of the population, but we have been giving out our vaccines as we have received them. Now, a long time ago when I asked, I think you have to look at the allocation to Sedgwick. You have to ask the state. I think it's a little bit, there's a little bit more involved than you are saying. I think there are, I'll leave those answers to KDHE, but in our case, we'd like to see more vaccines coming into the county.
And we have a question, how long do you anticipate the 65 plus group taking? It seems like we're feeling better about that every time we do one of these. So still probably a few weeks, I would think, for 65 plus, but it seems like we're optimistic about the pace.
The pace, so we need to qualify that. We think, like we've said consistently, that there are going to be at least 3 groups of people. There are some of us that would take the vaccine immediately. There's some of us, and that's a pretty broad continuum, that would take their time before they take it, and maybe they have questions that needs to be answered. And so I think you will find, and then there's some that will take a long time to take it, if at all. And Elizabeth brought up a point earlier. I don't know the kind of vaccine, flu vaccine that I get. I just get my flu vaccine. So I hope we get to that level. But anyway, to stay on task in terms of the question, is within every group that we have, just like we saw in our healthcare group, we will see those 3 groups of people. And I think those 3 groups are in our 65 plus. There are some that are ready to take it. Now, when we finished our 80 plus vaccine, last clinic was yesterday. We're still getting some requests, but not a whole lot. We're fitting them into. Now, we do have groups that by the way, another good thing that I need to bring up is today, working with our transit group, we took our first set of people who needed transportation help into our clinic. And so we finished all of those that are 80 plus, and now going to start working with those that are 65 plus. Those are some of those additional efforts there. But my point is there would be people in this group. There are people in this group that will have to educate. There are people in this group that we have to convince about the efficacy and the safety of the vaccines. And there are people in this group that we need to take extra effort to get to, who are not only who are at a disadvantage in terms of being able to get vaccinated, whether based on who is going to bring them, access to the internet and all the other stuff. So we're not under the illusion that we are done even after next week. We are going to continue to be creative, look at groups that we are missing, sometimes take vaccines to different groups. So it may mean that we're not having clinics designed for just 65 plus if we are not getting the appointments filled, but that doesn't mean that we're not working in those categories. One of the things that we've discussed that we have to iron out with time is, look, if you qualify based on age, we want to reduce the need for appointments and other obstacles. Maybe we get to a point where you can walk into a clinic with your ID card that shows your age and you can get vaccinated. So whatever it is, even beyond the next couple of weeks, if you are 65 or older, you continue to qualify to get vaccinated.
That would be great. Something to look forward to.
Yeah, and I'll just jump in too. So I believe it was this week, although the pandemic time warp has sort of mixed up my weeks, that we finally got access to the state's immunization portal, where we can actually pull reports and look at the number of individuals who have been vaccinated for Johnson County. We're now posting some of that data on our website, so you can go and see how many Johnson County residents have been vaccinated versus how many people Johnson County Department of Health and Environment have vaccinated. But we do know that we have a couple of our health systems who are working very closely with KDHE, but are still struggling to get sort of the file to go from their place to KDHE. So we're collecting a little bit extra data this week for what they've already done, and we've been doing that periodically. So hopefully we'll be able to look and see approximately how many of our 65 and up we've vaccinated. And then we may be able to draw some inferences about, how long it may take us to get through that. And so that's really what, from a data where I'm looking is if we expect, 75% of our seniors to be vaccinated, how long will it actually take given our allocations? And of course, everything is subject to change. Our allocations are subject to change. But either way, this third vaccine coming into our community, our pharmacy partners vaccinating, our health systems vaccinating, all of that is really good news in terms of us continuing to move through the 65 and up population so we can move on to additional phases and tiers.
So I know that would be, someone was asking, when are we going to get to the grocery workers? So that would, there's groups of workers who are in the phases that will probably come after that.
Yeah, and we're working on that. We're working on those logistics, and that won't be too long. We especially our grocery store workers, we're working on those logistics, and latest by next week we'll be putting out more information about those apps.
Great, good to hear. We have a question. Can you complete the interest form? And this would be for phase 2. If you're not quite 65 yet, but you'll be 65 in 2 months. Can you complete that interest form?
I'll let Elizabeth talk about what's in the works in terms of, because if you are younger than 65, you are technically in phase 3 or 4, but she and her team are working on that. So you want to talk about it?
Yeah, absolutely. So, I think go ahead and fill it out. It doesn't hurt if you're going to be there in a couple of months. By that point, in 2 months, we will hopefully be well beyond that phase. We'll probably be in the 16 to 64 phase, potentially, with or without pre-existing conditions. In fact, the White House said that they will have enough vaccine for every American by May 31st. Now, let's make sure we're reasonable expectations. That means it's produced. It does not necessarily mean it is in our hands or in arms. But that kind of pace is tremendous. So, hopefully if you're turning 65, in the middle of May, then we'll already be to your age group. So, as we're moving through this, we may be putting out additional surveys. So stay tuned for that. But I would guess that by the time that you turn 65, we'll probably be pretty close to having you coming in anyway for being 64.
Looks like we are getting close on time. Dr. Ariola, Elizabeth, any final remarks before we wrap up for today?
We just continue to ask our residents. The vaccines are safe, they are effective. Take them. We would be posting information as much as we can as to availability of the different kinds of vaccines, but it really doesn't matter. It's you take what's available and you get it. The J&J vaccine's been given to about 22,000 persons right now. No one's been hospitalized. No one's died. So it's been pretty effective in reducing severe critical illnesses. And the same thing with the other vaccines. Just we're in a pretty good place, having 3 different types of vaccines available in a very short time since we've been dealing with the pandemic. And so that's the one piece. The second piece is if you have any questions at all about the vaccine or any question that would impact your decision to take the vaccine, call us, email me, email Elizabeth. We will take the time to explain that, to answer your questions. We would go through how that's done. It's you can email us, jcdha@jocogov.org or 913-715-2819. We take the time to explain that to you. The good thing about these vaccines is right now, again, on the update from the White House yesterday, we have vaccinated about 78 million people in the country. So that's a lot of people. And so, and that should speak to the safety of the virus, of the vaccine. And because we vaccinated 78 million people and have tracked some of those symptoms that we see, and because that should speak to the safety of the virus, because we are seeing measurable differences in hospitalization and death in highly vulnerable groups like those that are older or in long-term care facility. That should speak to the efficiency of the virus. And so there's no reason to not. Candidly, it's our biggest tool, along with masking and other public health non-pharmaceutical interventions, to return us to life like we know it. Look, my mom's 83. I want to give her a hug. I haven't seen her in a while because of COVID-19. She's waiting to get her vaccine. Once she does, can't wait to see her and give her a hug. And so I hope that you're able to do that very soon. We all just need to continue to work together to do this. We've done very well. Let's keep the virus down. Thank you.
Great. Thanks so much, both of you, for sharing some information today. Thanks to those on Facebook who are asking questions and just engaging with us on this topic. We will go in there and continue to answer the questions that have come in either this evening or into tomorrow. Thanks to Kim for being here, and I hope you all have a great rest of your day. Thanks so much.